One of the biggest challenges in healthcare is getting patients to understand what they need to do to take care of their health, and then actually do it.
We can talk about diabetes, hypertension, weight control until we're blue in the face, but it doesn't mean a damn thing if the patient doesn't do something about it. OpenNotes is very simple. Doctors' notes would be open to the patients. This is a real change.
I'm Lynn Sexton. I'm 79 years old.
I'm Mary Ellen Sexton. I'm 77. We have 10 grandchildren and 6 great-grandchildren.
But she can remember all the birth dates for most of them, where I can't. I hadn't been to a doctor much until I was, 56 years old or something. Then I had a heart attack. I had gallbladder surgery, knee repaired, hip replaced. Twice, and
Hiatal hernia.
hiatal hernia.
Your blood pressure's perfect.
We're very good at telling people what to do. We're very good at hoping that they'll do it. And we know that we've been very bad over the years at getting people, helping people, urging people, convincing people to take real responsibility for their lives in a medical sense.
How about a couple of nice big deep breaths with your mouth open for me, please?
OpenNotes is so simple. Right now, in almost every setting, a patient goes to see a clinician, they talk, the clinician writes a note, it goes in the medical record, and the medical record goes on the shelf or into the computer. The idea of OpenNotes is to get notes into patients' hands. So through the medium of this shared document, patients can see what their doctors are thinking and facilitate a conversation between doctors and patients.
Taking all your medicines, Lasix, aspirin, lisinopril, Imdur, Zocor, atenolol.
Before we got involved with the OpenNotes, we had to remember everything we were supposed to. And
Flomex.
This way you can go right back and check it.
There's your weight graph. back in November, before the holidays, you were at your low point. A picture's worth 1,000 words. My initial reaction was that it sounds like a good idea. Working on that a little bit. My concern, though, was that it would generate more phone calls, and none of us really has time for more phone calls. But we got through that, and it's been pretty invisible to us. It's not required extra time or effort on our part. Most of the feedback from patients was very good and helpful. They came better prepared for their visits. They asked better questions. They knew their medications and their doses when they came in.
I check it quite frequently. Make sure that we've told the doctor everything we were supposed to and see exactly what's going on.
When I need something, I just say, Mary Ellen, look it up.
We have a huge burden of chronic illness, diabetes, obesity, hypertension, coronary disease, and people really need to be educated. You know, physicians need to be more of an educator than a dictator. OpenNotes sort of opens the door to that process.
OpenNotes took place in 3 very different sites around the country. Here in Boston at Beth Israel Deaconess Medical Center, a major urban teaching hospital. In Danville, Pennsylvania, a very rural area. And finally at Harborview in Seattle, which is a safety net hospital.
I thought it was very important not to do it in just one place or one setting. One of the hypotheses we had going into this was that it would be the well-educated people, the people with money, the people who use technologies all the time that would be most excited about OpenNotes, and we were dead wrong. And what we actually found out was that it didn't really matter where you lived, how old or young, or whether you were ill or healthy. There was just really a universal sense of excitement about it. Doctors, they were very surprised by how little impact it had on them. After a year, we said, you have a right to drop out, and not one doctor dropped out. More than 90% of our patients in OpenNotes chose to read their notes. 99% of patients said they wanted to go on with this. But even more importantly for me as a doctor, more than 80% said they felt more in charge of their health care. That's a mind-blowing result for a very simple intervention. It has enormous implications for the quality of care, for the costs of care, for outcomes, for the populace.